You can hear me all? Good afternoon, everyone. I'm Dr. Linda Harris. I'm the Chief Executive of Spectrum. It's absolutely fantastic to see so many of you in the room today from within Spectrum, some of our strategic partners and friends of Spectrum, and friends to be of Spectrum as well. It's just one big family really of care. And I'd like to thank each and every one of you for signing up to take part. I'd also like to pass on my thanks, and I'm sure there'll be other opportunities for me to do so today, to Jane Clark, the National Guardian, for agreeing to present to us today. And I'm sure you're all as excited as I am to hear what our amazing speaker has to say. And as we've mentioned, today's event's going to be recorded, so it'll allow us to share it more widely with colleagues who weren't able for one reason or another to join us, or also to keep in our back pockets for posterity, and to return to it. Just a little bit about how this Festival of Leadership and Learning has come to be. It's a series. We started it when we turned 10 years old as an organisation. And actually, as a learning series, it's been created to allow those who inspire others to find their own inspiration. And today's event, during the National Freedom to Speak Up Month, it's just an amazing privilege to host the National Guardian, Jane, talking about why freedom to speak up is so important and some of the barriers people can face in speaking up. And I don't want to steal the thunder. And, Jane, I just in the short amount of time I had with you before we set up today, I know this is going to be a fantastic learning and reflecting opportunity. Just a little bit about the housekeeping. You're all seasoned Teams people now, but if at any point throughout the session you struggle with sound or the slides, we often find that the easiest way is to leave the session and rejoin, and that so often does work. If you'd like to pose a question, you have an observation, reflection, please do use the chat. I'll be keeping my eye on it throughout to get us started at the point at which we can be interactive. And I'm sure there'll be plenty of time during this session to do so. And just finally, because I always forget this, there might well be a 5-minute survey relating to this event after. It's so important that we evaluate events such as this. So please do, when you see it, complete it if you can, because these events just we can tweak them depending on the feedback that we get. So without further ado, and this is genuinely one of the best introductions I've been able to ever make in my professional career, I'd like to hand over to Jane, our guest speaker for this evening. Oh, you might be on mute. Oh, there. Oh, we can't hear you yet, Jane. Oh, try. Oh, we're here. I can hear you. Oh, no, it's gone again. You're on mute again.
Right. Mic is on, will stay on. Sometimes, I don't know if anyone else finds it with Teams, the mic gets a bit like it's been overworked today, obviously on, off, on, off. So forgive me. Linda, thank you for your really warm welcome. It's absolutely brilliant to be here. So many of you on the call already. I can see we've got over 50 here tonight, which hopefully is reflective of the importance that you as individuals and you as your organisations give to improving the culture in your organisations. So I have been asked to talk a little bit about, my background and what we do as an office, and then to share some of our learning on this journey to help you think about what your improvement journey is like, and what you can be doing both individually and then within your teams and within your senior leadership. So it's a fantastic opportunity. I've got a slide deck, so I hope that's okay, just to sort of shape, I guess, my thoughts around. And then I'll allow plenty of time, hopefully not just for Q&A. I mean, obviously there might be some questions you have for me, but for a discussion, for you to give me your feedback, to share with your colleagues what you're doing, what's working, where your challenges are, a dialogue, because I think that's how we learn best. I certainly don't have all the answers. I've been National Guardian now for best part of 20 months. I think I started December 21, and I think I sometimes feel I know less than the day I started, because there's so much to think about and to learn in terms of organisations and that psychological safety and stuff. So I hope you're not expecting I'm going to have all the answers, but hopefully I can help us with our thinking and your approach and your challenges and help overcome those. So I'm going to share my screen and hopefully it's going to work this time, even if my microphone didn't. I'll apologise in advance if anybody comes to the house. I'm working from home this week so that we can get more presentations in than when I go to individual organisations, but it does mean I do have 2 rescue lurchers and they sometimes get excited if people come to the door. So if I have to shut them up, forgive me. So here we go. Hopefully this is going to come up and it's going to say Spectrum. Ta-da! Please, when it comes up, could somebody tell me you can see my slides?
Yeah,
lovely. Oh, I can't. I get the orange flashing saying that we're still working on it. But if you're seeing it, that's great. I just can't turn them on at the moment. Let me, by way of background, then just tell you a little bit about me. So yes, I'm the National Guardian, but what else am I? So, there it is. I can see it now. I am a nurse by background. For more years than I'd probably care to remember now. And I've worked both in clinical roles. My clinical specialty was end-of-life care and care of the dying, cancer palliative care. That's what my PhD's in, outcome measures in end-of-life care. And then I've been in various leadership roles over a lot of years, including working for NICE, including working as a non-exec director in a CCG. So I have that non-exec experience as well as an exec director. And more recently, working as the National Guardian for Freedom to Speak Up. And I want to think about within our context of this month's Freedom to Speak Up awareness raising month, breaking barriers. So we're going to have a think about what do we think inhibits people from speaking up, what gets in the way, what barriers are there, and then what role leaders and managers do. This is your leadership workshops, what your role is in listening well and following up, because that's really part of the key, I think, to unlocking this this challenge. So I'm going to start with a quote, and I love this quote, and I make no apologies for using it. Those Guardians that are on the call, I can see there's a few of them. Forgive me. I know you see me use it quite a bit, but it is so powerful. Why wouldn't I use it? I haven't found a better one yet. If you've got a better one, please give it to me. Megan Wright, researcher across many different types of sectors into psychological safety and speaking up, says the silence of missing voices costs careers, relationships, and lives. So just slow down there to allow you to take that in. That is what we're talking about. Missing voices in your organisation, or your voice missing, be it about patient safety, worker well-being, bullying, harassment, incivility, be it about significant issues, an idea for improvement that might revolutionise the way you deliver your services. If you have missing voices, it can cost careers, relationships and lives. And not just missing from the context of I can't speak up, but missing in that I haven't been heard. So I've spoken up. Maybe I've gone to my line manager. Maybe I've gone to Agnes as my Freedom to Speak Up Guardian within Spectrum. Maybe I've gone to talk to Linda directly because she seems a very approachable chief exec. Maybe, maybe I've gone to a colleague. Maybe I've gone to HR. But if my voice hasn't been heard and I don't feel I've been listened to understand, and certainly I don't feel anything's been done about it, or there's a rationale for why it hasn't been done, but I don't know about it, that can cost the careers, relationships and lives, because I might never speak up again in the future, or I might have spoken up about something really important, but it was never heard. So it's still, I classify that as a missing voice. So today, when we're thinking about for you in the context of leaders and managers, be you senior leaders at the top of an organization, or be you senior leadership, very senior leadership team, or you have a significant management role, or you are in the early stages of your leadership journey and you manage a small team. This is vital for all of us to get this right. And nobody, I can say it now, I don't get it right. No organization is getting it 100% right 100% of the time. This stuff is tough. And in fact, the conversation that I joined earlier, I got in 10 minutes early to check that the IT was working, and they were having a conversation about being comfortable with the uncomfortable. And I love that analogy. And someone who's been brought up working in end-of-life care and care of the dying, that was really important back in my early 20s, getting to be comfortable having conversations with families and indeed with the public about death and dying. Not just talking about someone that's passed, actually being able to say the word, yes, they have now died. or yes, they are going to die, or nurse, or, sitting on the ward round with the nurse and the doctor together with a family relative. Is this it? Well, first of all, understanding what you mean by is this it, but being comfortable with what is it they want to know, and how do you gently take them in that steps to prepare for that. So I had a good, if you like, training in being comfortable with the uncomfortable, but I still don't find it easy. I certainly don't find it easy if somebody speaks up to me about something that maybe is about me or about my team or my leadership. It is not easy to be comfortable with the uncomfortable, but if we can't embrace it as leaders and as managers, how do we expect others to, and how do we expect that to change? So I guess my first takeaway message for you today is, where might there be silence in your organization? And that silence of not being able to speak up, or silence that we're not hearing, la, 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 not listening, not listening. Yeah. So I won't sing again, I promise. Um, so that's the first message. And then the second message is, how comfortable with the uncomfortable am I? So we exist as an office, the National Guardian's Office, and me as the National Guardian, to lead, train and support a network of Freedom to Speak Up Guardians. We now have over 1,000 in over 650 different organisations of different types, which is, from 2016 when the office was set up. And we were set up in response to Sir Robert Francis's inquiry into the care failings at Mid Staffordshire, and then his Speak Up review that he did shortly after. And what he found was that mostly workers knew that things weren't right within that organisation, but they didn't feel able to speak up, or they felt they had spoken up and nothing had been done about it. And so he felt, okay, the traditional routes of line management, HR, patient safety, unions, weren't working. And so therefore he said, I think we need to have a safety valve here for another route for people to speak up confidentially and to help an organisation improve their speak up culture. So that's what the Guardians exist for, to work within their organisations to improve culture. And so it's a two-part role. It's a proactive working with leaders and with the workforce about what needs to change around here and how can we change it to make it safer to speak up. And then to actually provide case management for people who want to bring an issue to a guardian. And us as an organisation, we lead, train and support them, but then we also conduct speaking up reviews to identify good practice and where practice isn't so good. And we also provide challenge to the whole system. And I lay an annual report before Parliament as demanded by the Gosport inquiry every year. And hopefully, fingers crossed, we will get a grid slot for that report to be laid before Parliament this October, which will be good because it's Speaking Up Month and it might raise awareness and hopefully something that you can use within your organisations. So that's who we are and who I am. But why speaking up? What is speaking up? So for me, when I talk about speaking up, I'm not just talking about speaking up to Agnes as a guardian or any other guardian who's here on the call today. I'm talking about speaking up in the whole, because speaking up is about me as a worker in my workplace feeling able to contribute to an improvement culture, feeling that actually I can raise issues about patient safety. I can make a protected disclosure if I feel it's protected, or a qualifying disclosure under law. But actually, most people don't think that they're going to be identifying necessarily as, I'm going to blow the whistle on this issue if it's a serious issue. But actually, they think, I'm doing the right thing. I'm going to tell somebody about this because I think there's an opportunity to make it better, safer, or improve our services. Whatever we call it, it's speaking up. Do I have a voice to speak up about what gets in the way of me doing my job? And really importantly, when I talk about speak up, I'm talking about it as an overarching process, and it's threefold. It's speaking up. So can I speak up as an individual? And then when I do, is it heard? Does the person I speak up to, be it my line manager, HR, safeguarding, patient safety, Agnes as my guardian, sorry to pick on you, Agnes, do I feel listened to understand? Do I feel really heard, that someone understands what I'm saying and therefore we can talk together about what potential outcomes might be needed to come out of this? And then really, really importantly, does my organisation follow up on what I've said? Do they act to implement a change if need be to improve something, or do they at least tell me why they're not acting on it? Yeah, because that feedback loop is essential, and more of that in a minute. So for Speak Up to Work, we need to have, as leaders, we need to have a growth mindset. And if that's not probably a term that probably is a term that's familiar to most of you, but if it isn't, a growth mindset is about, do we see the things that people bring to us as an opportunity for improvement, or do we see it as a problem? You know, when you get that knock at the door at 5 to 5 on a Friday afternoon when you're hoping to shut up shop and get off to your weekend and finish your report stuff for Monday morning, etc. Can I just have a word, Jane? Does your heart sink? Quite often it may sink because you're tired and it's the end of a very long week and you've still got masses to do before you can finish and get home to your family. But actually, this might be the opportunity for someone coming to say something really important. So we check out the priority of it, because I'm not saying that you should be at the beck and call of everybody the whole time, but we check out the priority. And then do you think, oh, I don't want to hear this because this is maybe something that's really not going well. Maybe it is bullying and harassment or incivility and disrespect, or maybe it's an important patient safety issue. Am I comfortable with the uncomfortable? I do want to hear this. And it maybe it's fine to say, I hear you. Does this have to be addressed? How urgent is it to be addressed on a Friday afternoon? Can we set some time early next week, etc.? Or maybe we can't and it does need to be addressed. But the fact is, do I see it as a problem, or does I see it as, well, okay, I don't have as much time as I would like to give this, or this is yet another thing, straw that breaks the camel's back potentially, but is it an opportunity for improvement? Is it an opportunity to make my services better? Is it an opportunity to improve someone's working life so they stay and want to keep working with us? This is the important stuff we're talking about. And to get it right, we as leaders need to have that. I consider it a gift, hence my little gold gift box there. It's not because it's only, 3 months till Christmas. Sorry, I did mention the C word. You are allowed to tell me off. But, it's a gift box. That's what our workforce give us, is a gift. Every time they give us some information, every time they speak up about something that gets in the way of them doing their job, it's a gift, even if it's uncomfortable, because it's not what I want to hear. If we think about recent events in Countess of Chester, that information that it appears that clinicians gave about potential serious, significant worries about potential harm being, thinking the unthinkable, that would be hard to consider that a gift, but actually it was a gift of potentially saving other people's lives. And we don't know yet. We need the outcome of the inquiry, etc. But the fact is, when people come to us with a patient safety concern, with a bullying and harassment concern, with an idea for improvement, it's a gift if we will only accept it, even if it's an uncomfortable gift, because it means we've got to act or we've got to listen and do something with it. But if we don't take it in that spirit, we may become defensive and we may miss opportunities. And I don't know about you, but having been around the block a bit, we develop different mechanisms as both as human beings and as managers and leaders. And that can be to deflect a conversation away from what I don't want to hear. I haven't got time to hear this. So, is that the time? Let's pick this up next one-to-one. If I was to ask a quick straw poll of people's strategies for closing down a conversation, I bet we all have hundreds of them we could share with each other. Oh, I didn't know that one. I might try that next time. And I'm not saying sometimes we don't need to close down conversations. Of course we do. But actually, are we closing down the conversations too prematurely to really listen to understand what matter someone is speaking up to us about? Because it could be an improvement that might be life-saving, might save your organisation millions, might retain another valuable member of staff rather than having another vacancy. So that's the stakes we're talking about today. And we know it's important because if things go wrong, we need to learn from them so they don't go wrong in the future. If things nearly go wrong, we need to learn from them and make sure we prevent that crisis or that bad outcome happening. And when they're good, we know they can be better. And I think there's such a strong correlation between a good speak up culture and a good quality improvement culture. And across all your organisations up in the north, I know that you want to be the best. We all come to work to do our best and to make things better for the people that our organisation runs services for, and for our workers who work alongside us or in our teams, etc. And you as leaders, that will be very, very much on your minds. So this is something that we need that significant conversation about and that significant attention to. We did a review of the ambulance sector last year around their speaking up culture, and it made for some difficult reading. But one of the things that was really hard to read was an interview with a senior leader in the ambulance trust, where the leader said, we know, I started here I don't know when, they started a little while before, and they said, when I got here, the organisation was very clear with me, the leadership was very clear, we know we've got problems with racism, sexism, homophobia, inappropriate sexualised behaviour. We know we've got these problems, but we just can't address it yet. We will address it, but we can't address it yet because we've got to sort out waiting times first. No, I understand that under the operational pressures that people are under currently within our health services, and not just health, because I know there are people here from other sectors, maybe here from, a justice sector and others. But we ignore culture at our peril if we say we've got to sort out the other KPIs, because we're never going to get fantastic responses on our KPIs and our performance if we don't really seriously address the cultural issues, because significant safety issues may occur, either safety of workforce or safety of people who are in receipt of our services. So absolutely vital. And it matters because of the human cost, it matters because of the patient safety and experience cost, it matters because of worker well-being. That's a shocking stat, isn't it, that over 2 billion is spent on bullying and harassment in our NHS. And, the vacancy levels that we're running on. And if I'm working in one of your organisations and I don't feel my voice is heard, and I see significant issues of bullying or harassment or microaggressions, racism, or I see poor patient outcomes that could have been averted, but I don't feel anyone's really listening to doing anything about it, I'm going to go and work in an organisation where it's better. Hopefully, if I can, if I'm not tied particularly geographically, etc. We know that workers talk, and you get a bad reputation, people aren't going to come and want to work with you. So we ignore that at our peril as well, let alone the patient safety and worker well-being significance. And, can we afford under the risk management strategies to ignore this? The legal standing in the NHS standard contract around having a good speak up culture, CQC ratings, it matters. We just know it matters because it's the right thing to do, but there are a lot of other levers to help us make it matter within our teams as well. And whose voice matters? For me, absolutely. I spend a lot of time talking about workers because that's what I'm employed to do. But I don't ever want you to think that I ignore the voice of people who use services and their families, or the voice of the public in these important issues. But obviously, here today, as the National Guardian for speaking up, I'm going to be talking about workers. And in our NHS People Promise, it very clearly says each of us will have a voice that counts. Does it? Hand on heart, within your organisation here tonight as a leader, do you feel that everybody in your organisation has a voice that counts? And do you feel they know that? Do you feel that if you went and talked to them and had a cup of coffee with them, do you feel your voice really counts? What are they going to be saying to you? Now, there's a conversation that could make us as leaders feel uncomfortable. But it's okay to be uncomfortable. If they say, no, actually, I don't feel, well, okay, help me understand what needs to be different. And then you get into a dialogue about it, maybe with your staff networks, with your inclusion groups, with your groups of people who are living with a disability, groups for people who are maybe from some of the known barriers to speaking up. And we go and talk with them and we say, what's it like? Do you feel your voice counts? And I'm not suggesting that Linda has to go and talk to everyone individually, for example, as chief executive of Spectrum. However, using those different forums you have to amplify staff surveys, pulse surveys, the data that you have is so important. Because if we don't ask, we're never going to find out, or we'll find out the hard way when people don't speak up or when they've spoken up. And as leaders and managers, we haven't listened and acted appropriately. So let's just think a little bit. We're in Speak Up Month and we've themed this one around barriers. Let's just think a little bit about barriers to speaking up, because Sir Robert acknowledged them in his reports about fear and futility. And those are echoed in recent staff surveys. If we look at the NHS staff survey, I know not all the organisations represented today are from the NHS and will do the NHS staff survey, but we have in the NHS staff survey 4 questions that ask about how confident are you that you would raise concerns of a clinical nature, and how confident are you that you'd raise concerns generally, and how confident are you that your organisation would act on those 2 types of concerns. And then we ask about what the barriers are. And what we see is that people, in terms of the figures there, so this is overarching for the whole of the NHS, I feel safe to speak up about anything that concerns me. That question, 61%, that means 4 out of 10 don't feel it's safe in their organisation to speak up about something that matters. Just under half don't feel, just over half don't feel they'd speak up about patient safety. And that's of the people that completed the staff survey. And we know that there's survey fatigue and response rates are anywhere between 40 and 60%. That is a sobering thought, isn't it? And if we think back to that original quote of missing voices, What is that telling you about where there are missing voices in your organisation, about who would speak up to you about what you would hope that you want to hear about? Absolutely key. And we know there's been a decline from last year. Now, there could be lots of reasons for that. And obviously, within an average, some organisations have got better, some have deteriorated, but overarchingly, there's been a small decrease everywhere in that confidence. And that worries me. And that's why I do take up invites like this to talk to groups of leaders, to encourage you in your thinking about what are we doing? Are we doing enough? Are we having enough conversations? Are we doing enough to make this and actually turn this around so that actually over 80, over 90% of people in my organisation feel it's safe to speak up about anything and feel safe to speak up about clinical matters if needs be? And we need to understand the barriers. We need to understand because different groups face more barriers to speaking up than others. And we know this, it's well researched evidence. We knew, for example, during COVID, that people from minority ethnic backgrounds often felt less able to speak up, for example, about lack of access to PPE. We know there's some inherent challenges within different groups for people feeling that they can speak up. And what's really important is that we recognise that. But I would go back a step further and say, first off, to you as a leader, do you recognise what barriers you might have to speaking up? So if I think about Jane, who might I feel comfortable? I'm working in, one of your organisations. I come and join you. Who am I more likely to feel comfortable going to speak up to? Might be it's someone that looks like me. Might be someone that maybe's had a lived experience of something that I've experienced. So, say for example, I've had experience of mental health challenges in the past. So, might I feel if I know that one of my leaders has, or my line manager is empathic, I might feel more comfortable about speaking to them. I am a gay woman in a leadership position. Might I feel more comfortable with talking to somebody that I identify with who maybe comes from the LGBTQ plus background? I'm not saying I would, but I'm just saying these are the sorts of things that I think as a leader and as a manager and as a worker in an organisation, what are my barriers to speaking up? Might it be that I'm on a short-term contract? I've come from overseas to work over here and I've got a short-term contract and I've got a short-term visa. If I speak up, am I unlikely to get my visa renewed? That means all my income going back to help and support my family at home is gone. Am I going to be less likely to speak up if I'm in a group that maybe faces a set of unique circumstances around my visa status? I'm a student and I work in your organisation. If I speak up about something I've seen and I'm worried about, am I going to have a bad mark on my placement because I'm seen to be a troublemaker? Am I going to then, maybe potentially thrown off my course? I lose all those thousands of pounds I've paid for my training. All these things can impact a person, and I think we start off with us. So what might my barriers be? And then recognizing that the barriers for me to speaking up might be, I'm much more likely to be empathic to thinking about, so with my team and with my colleagues and in my organization, these are different sets of circumstances. We need to have conversations with people who are living with those experiences and those particular characteristics, be they protected or otherwise, to say, how do we make that safer for you to feel you can speak up and overcome those barriers? And this month is all about breaking down barriers. So my encouragement to you today is, do you understand your barriers? And do you work to understand the barriers and the people you're working with? And then not just recognize them, but what are we going to do about them? How are we going to make it safer to speak up with those different characteristics and the intersectionality of those different characteristics? Because hierarchy, short-term contacts, culture where we come from is absolutely key. I've spent some time working with Jennifer Cagria. She is Ruth May, the Chief Nursing Officer in England's International Nurse Advisor. And we spent some time talking earlier in the year because we absolutely recognise that for our internationally educated workforce, for some cultures, it can be particularly hard to speak up because you're just not brought up feeling that's respectful and appropriate. I have lived experience of that. I went to work in India for a few weeks on an elective after I finished my nurse training, and I was in a leprosy hospital out in the middle of nowhere, and there was they were doing amazing reconstructive surgery. We're going back now into the late 80s, and I used to have hair colour back then, and I remember going on a ward round on the first week I was there, and the consultant was going around and the nurse was there. And I had a question. Now, I'd been brought up as a questioning nurse student in where I was educated here in England and at the university I went to. So I went, Dr. So-and-so, could I ask why? Oh my goodness, I was whisked off that ward round quicker than you can say baked beans, and was chastised by the nurse. No, you don't do that here. Nurses don't speak to doctor like that, and certainly not at ward round. And I'd done it in a compassionate and respectful way, but it was just a no-go area because that was considered disrespectful at that point in time in that particular hospital act culture. And I was talking to Jennifer, and she has 27 different networks from 27 countries from nurses that are coming over. And this is not just an issue pertinent to nurses, but I use this as an example. But it's exactly the same for internationally educated doctors or physios, or if someone comes from a different set of cultural norms, we need to understand that just saying we've got a speak up policy and it's an expectation within our professional guidelines that you will speak up isn't necessarily going to make it safe for someone to speak up. Because if it doesn't feel comfortable, because I've been taught that I can't speak up to my seniors, to maybe just someone of a different gender, someone in a different clinical status, these are all things we need to understand so we can have those conversations. And we encourage our guardians to go on inductions, and particularly to take time to spend time with the internationally educated workforce to ensure that they understand what the culture we're aiming for here, and then talking about how does that feel for you, and would you feel able to, and what would you do about it. So I think first stop, so another takeaway here for me today for you, if you wish to, is what are we doing to understand the barriers? What conversations are we having in our organisations and in our daily conversations? So it's not just about what happens at board when we have reports around this. This is what's happening in my everyday conversations with people that I mentor, with people that I line manage, with at my team meetings, at handovers, at appraisals, at exit interviews. We're making this everyday conversation, because if we don't start or continue exploring those barriers and co-creating ways of overcoming them, because we don't have all the answers to how you do that, which is partly why I love coming to these sessions, because you'll be hopefully telling me what you're doing to overcome some of these barriers, to really give people the voice that we want them to have and that we as leaders want and embrace them to have. So just keeping an eye on time, we've got a few more slides. I just want to talk very briefly about psychological safety, because this underpins good culture, doesn't it? And I like this stepped approach to thinking about psychological safety. There are many things out there, and I would just encourage you to have those conversations, but are we making it an explicit priority? I talked about that at the beginning. Are we saying that psychological safety and speak up culture is a priority, as much of a priority as our KPIs around performance? Are we facilitating everyone speaking up? I've just been talking to that. That means everyone. That includes people who are from different groups that might find it more difficult to speak up because of their particular characteristics or intersectionality of characteristics. And it's a recognition that we are all different, and who I feel comfortable to speak up might be different to who Linda feels comfortable, to whom Amy feels comfortable. And we have to recognise that, and then we have to do something about it by having those everyday conversations. It's also about establishing norms for how failure is handled. What's it like in your organisation if I make a drug error, if I'm a clinical clinician? What's it like in your organisation if I get something wrong, if I forget to do something that I should have done? Do I cover it up, or do I put my hands up and say, I'm really sorry I did this, and let's take the learning from it, because you have a just and no blame culture? Apart from obviously if someone is has a capability issue and repeatedly does something wrong. I'm not saying that it's a license to just do what you like, but we do it within that just and compassionate framework. So we establish the norms for how that's handled, and we make it normal to have conversations about it, creating space for new ideas. That comes back to my link between QI culture, quality improvement culture, and speak up culture. And finally, I love this one about the thought of embracing positive productive conflict. Maybe it could say positive conflict as well, but really important that we are comfortable with the uncomfortable conversations, including I might disagree with Linda how to do something within our leadership meetings, but if I do it with compassion and we have a dialogue about it and it's done respectfully and compassionately, we might get to a better solution than just not having a conversation and not feeling that. And maybe conflict's even the wrong word on here, because it's about having professional creative dialogue that can include check and challenge. This is someone else's slide, not mine. Because this is all our responsibilities. So I love this quote. I love Brené Brown. I probably would be at any opportunity listening to her live. I never have. I've seen quite a few YouTube talks and what have you, but she's she's a social worker by background and does social sciences research, talks about vulnerability and trust. But I love this quote. Just read it for a moment. If we want people to fully show up, bringing their whole selves, So to innovate, problem solve, serve people, that's what all your people are about in the organisations that you do. We have to be vigilant. Underline that word. We have to be vigilant about creating a culture where people feel safe, seen, heard, and respected. Vigilant. That means everyday attention. If you're vigilant, it's not just vigilant once a day, once a week, once a month. If you're vigilant, if you're on guard, in a situation where you're guarding a property against, intruders or something, you wouldn't just do it now and again. You wouldn't have your security cameras switched on just, an hour a day to save electricity. If you're being vigilant, you're being vigilant. So this means the opportunities that conversations with people, because I think sometimes we make speaking up into something bigger than it is. And I don't know if you know what I mean. I've not said that out loud, but I'm just thinking about it while I'm talking to you today. In the sense of it is really big, but in the sense of it's about conversations. How do you build trust? You build trust in conversations. Again, another quote from Brené is, you don't build trust in a sweeping gesture. You don't. You build trust is built by actions, speaking, evidence. That's how I build trust in Linda as my leader, for example. That's how I build trust in a relationship with a human being outside, a friend. It's trust is built in everyday conversations. And when it comes to a speaking up culture, it's conversation by conversation. And it's that vigilance. We need to be vigilant about barriers. We need to be vigilant about breaking them down. And we need to be vigilant about our conversational opportunities to really listen to what our workforce are telling us and then act appropriately. So just a couple of moments sort of towards the conclusion of my talk. I want to talk about, sorry, I skipped over that, just basically some of our learnings as to what helps facilitate a great speaking up culture for you to think about as leaders. So I talked a bit about this already. Trust is so much, in terms of, if you think about a freedom to speak up culture, it's much more than having a guardian. It's all those different areas in those overlapping Venn diagrams that you're working on in your organizations. It's your civility and respect program. It's your health and wellbeing program. It's your EDI program. It's your compassionate, inclusive leadership. You're just an, open learning culture that I've talked about. All those make up that underlying culture that you have about how safe is it around here to raise important matters that get in the way of me doing my job and doing it well. And because of that, there are a number of facilitators for you to think about. So your internal facilitators are things like what you have at board level, your non-exec and your executive level director support for this speak up culture improvement, having a chief exec that gets it and actually has it very, very high up front in what they're doing as a leader. That culture matters. That you've got your support for workers really embedded in what you're doing. And it shouldn't look smaller, actually. I need to change the font on that, because that proactive and partnership work is key. And I've talked a bit about that co-production with people who are living the experience of working in your organizations, about what's getting in the way of them speaking up to you as leaders and being heard, or maybe not what's not getting in the way of them speaking up, but why they don't feel heard and they don't feel things have been acted upon. Are you completing that feedback loop? And then you've got the external facilitators here. So it's about regulation from CQC, NHS England. It's the policies that underpin all this. And the professional regulators, we have guidance for doctors, for nurses, for allied health professionals. These are external facilitators that you can rely on and you can use in your conversations with people. This is why it's important. It's because from a regulatory perspective, it's important, but ultimately it's important because it's the right thing to do for our workforce, as well as for, most importantly, for the people that use our services. So that says what the previous one did. Sometimes I like to leave that up, but I'm just going to skip over that one on the answer time. Your role as leaders is crucial. I put my little gift box here just to remind you. Hope it's not too cheesy, but it's really important. Are you as a leader role modeling how you want your issues to be spoken up, to be listened to and acted upon if you speak up? Are you making it everyday conversation? A bit like a few years back with the big push on safeguarding training and making safeguarding everybody's business, I think this is on a par with this. Are you putting it into agendas for team meetings, for directorate meetings, for governance meetings, for safety huddles, for conversations? What are you doing to ensure? And if you're not working in a mainstream NHS organisation, but maybe you're working in one of those partner organisations here today and you're hearing about this, you might not have a Freedom to Speak Up guardian in our policy, but what do you have? And do you have enough? And if you've got models that are working for you, tell us about them as your health partners, because we want to know. I lead a vibrant pan-sector network. I bring together quarterly leaders in this space across all sorts. We have representation from retail, from banking, from aviation, from the space agency, from obviously NHS, fire, police, military, people who are all in sectors grappling with getting speak up culture right, because we know when we get it wrong, it can have catastrophic consequences. Or least catastrophic, just poor performance, but at its worst, catastrophic consequences. So, what are you doing if you're here today and you're not, as I say, as familiar maybe with our speak up culture? If you're watching this later, thank you. And I hope you're finding it helpful, but find out what health are doing and share with them what you're doing. And maybe, share ideas, look at some of the resources that we have and from our experience in health, because it is absolutely vital as leaders that every day you make this a major part of your mantra, and how you do your business is, it's not so much what, it's the how you go about it. How, that's why I think I remember a teacher of mine at school saying, Jane, you've got 2 ears and 1 mouth. There's a reason for that. I don't know, I can't remember which one said that, but actually that's stuck. We need to listen to understand before we speak and before we act, but then we do need to speak and act. Keeping it at the forefront, looking at your data and having that curiosity around what this is telling us. Have the right training, and use this opportunity of October, to do a bit of a reset. Okay, what we're doing well, what could we be doing better, and what's our action plan to get to where we want to be, and how are we going to involve our staff, not just tell them this is what we're doing, how are we going to co-create with them, making our speak up culture better, and above all, be curious. Not who said what. Maybe a guardian or a manager comes to you as a leader and says, oh, I've heard such and such in such and such departments going on. Who said that? Wrong question. What did they say? What's the message? Because it's not about shooting the messenger or disproving the messenger. That's what someone's feeling and they're thinking it's important enough to tell you. Be curious about the content and then act appropriately. And really important, if we're going to think about how to combat fear, one of those big barriers, we need to think about what happened, what changed. We need to tell stories. We need to get better at telling stories. I think there's some statistic, isn't there, that if we have a bad experience, we tell 10 people. If we had a good experience, we're lucky if we tell 1. So get out there in your organisations and celebrate what you are doing when you listen to your workers through whatever route they're speaking to you, and you're doing something about it to change, because that's going to build that trust within your organisation. Obviously, you need to do that in a confidential manner, but really important to combat that fear of futility, because actually it is okay around here if I speak up about what matters. And gather feedback. When I have spoken up, if we gather feedback through the Guardian route. We ask Guardians to ask people who they've handled cases for, would you use the Guardian route again? Over 80% of people who give feedback to Guardians, and obviously not all of them choose to give feedback, those that do say they would speak up again and use that route. Well, that's an endorsement of that Guardian route and the trust in it, isn't it? So when people speak up through the other routes, it's just as important to take that experience on. And really importantly, given that the biggest barrier was fear of detriment, fear of something going wrong if I speak up, in our NHS policy, we say how important it is that people feel safe to speak up and they won't suffer detriment. But sadly, we see it too often in the high profile cases. People do feel that things go wrong. So what are we doing as an organisation about it? How are we collecting data on it? How are we having it in a conversation? It's not enough to have it in a policy as zero tolerance. How do we enact that and follow through if people do feel they've suffered detriment? Educate yourselves as managers and leaders to understand what detriment looks like and what it looks like to different individuals. Share themes in your reports so that you can have honest discussions. Risk assess maybe particular groups who might be vulnerable to potential detriment. Keep in touch with people who've spoken up and see how they're feeling, obviously, again, confidentially. Find out how they are, how they're feeling as part of that process. And really importantly, be explicit about actions you've taken in response to detriment, because again, that's going to build the confidence and the trust. So my final slide to you is just to say to you, you really matter. You really matter, because all of us have a role in improving an organisation's speak up culture. But as leaders and managers here tonight, absolutely, no board, no senior manager can do it alone. It's all our responsibilities, both as workers and as managers and leaders. You really matter. So what's your commitment tonight to going back into your organisation, having maybe a slightly different conversation tomorrow at all different levels and keeping it forefront of your mind? Maybe add it into your objectives for next year or this year, add it in as a separate one this year. Be inspired to put this at the forefront and keep it at the forefront, even though it does demand effort to do so when you've got multiple competing priorities. But I don't think we can afford not to. I really don't. And I'm just going to leave you with this pause for thought. The standard you walk past as leaders is the standard you accept. So if you choose not to listen to somebody, you're choosing to accept that that situation that they're talking about is okay. If you see someone as a human being, as an individual being racially abused or microaggressions, and we walk past it, we're accepting that as an okay standard. So we need to have that moral courage of being comfortable with the uncomfortable as leaders and addressing issues in a sensitive and compassionate way, obviously, but we need to address them because otherwise we're accepting that standard that we're walking past. Loads of resources on our website. Feel free to have a look and a rummage, and obviously you can always contact the office if you want more information. This month is all about breaking down the barriers. Please, though, don't make it just this month. Please make it every day, every conversation, because that's vital. Thank you.
Wow. Thank you so much, Jane. I just wanted to have a bit of, it's so hard to have a bit of silence, isn't it, in this noisy world of ours? But I just felt that your presentation just deserved that. And I just wanted to thank you for your leadership and for your modelling of just some amazing your communication skills as well, and taking us through that. Yeah, lots to think about.
Thank you,
I know
Linda.
you.
Can I just, in response to that, can I just say, I don't get it right all of the time. I'm on a journey myself. We all are, aren't we? So I spend a lot of time, talking about this because I'm passionate about it and it's my job to talk about it, but that doesn't mean I have all the answers. So I'm really pleased to be here to hear from you as well. If you've got thoughts, some of you are not in the NHS here today, please tell us. I'm interested. Well, I've just while people start getting warmed up thinking about question points, I'm interested. What do you do if you're, for example, carrying out healthcare within a prison environment and you maybe see something untoward happening between prison workers and the people they're looking after, and maybe they're being bullied or maybe they're being abused in some way? Who do you speak up to, and are there routes that you would be able to escalate that rather than being a bystander too? And I see someone had put in the box about silence is complicity with the oppressor. Absolutely. And I'm not just bringing out justice there, but I know you have justice services, but in an NHS trust, for example, you've got very singular routes, but I think a lot of your workforce with their distributed model and some of your partners might think, okay, so what do we do if we see elsewhere? And again, you may have great routes of escalation and it's all good, but do we encourage each other across organisation to speak up about the matters speak up about the issues that matter? But I'll shut up.
Oh, thank you, Jane. And you posed so many questions to us, didn't you? Where might the silence be in our organisation? How comfortable are we with the uncomfortable? Do we feel that everyone in the organisation has a voice that really counts? And conversations that you're having, they're very powerful questions, and they deserve to be asked and for us all to sort of reflect on. I'll open it up to colleagues. There are some amazing comments and observations in the chat, and we will make sure the chat's available, written up to everybody. But is there anyone that wants to pick up the challenging question that Jane has posed to us, particularly those of us who work in health and justice and have that responsibility of interfacing with the Ministry of Justice, with the Home Office, really strong, powerful departments which health, has to interface with. So, but really, I'll open it up. Don't be shy. This is your great opportunity.
Linda, Jane, can I just thank you firstly for a really, really interesting talk. Really, it's really made me think, and it's probably one of the first times I've sat silent for about the last hour and not fidgeted when I've been listening to somebody. Your question, I've worked in health and justice for 34 years. that's where I decided to specialise in, firstly going into female estates and then into male estates. The culture now is different from the culture back then. Back then, as you know, people did turn a blind eye to things that went on in prisons. Now, I would hope that any of our staff would call out any prison staff that they saw had any untoward practice. And I would hope vice versa as well, that they would call any of our staff out as well. And it has recently happened. Probably in the last, I'd say this year alone, it has happened that their staff has called out our staff, and we welcomed that, and that has been investigated. So I think it's joint working and joint understanding of where the reporting lines lie, that both organisations are comfortable with those. But thanks again, really, for that.
No, thank you. And sorry, I've got the sun coming through my blinds, so I'm feeling a little bit blinded here. Let me just quickly take my headphones off so I can shut it, because otherwise I'm going to be fiddling and trying to. Much as I hate shutting the sun out, that's better. No, thank you, Sandra. And yeah, I wasn't making any judgment that was happening. It's just, and it might not be as much, as overt as what we might have thought happened years back. But actually, in any of our organisations, the microaggressions between people, are they being called out in a civil and just way, as much as obviously some of the bigger issues that we sometimes see hit the press, etc. But thank you, Sandra, and I'm glad it's been thought-provoking. That was the idea. That's what Linda wanted, was me to come and talk to you and pose you some questions. We've got lots of guardians on the call. I can recognise quite a few names from, which is lovely. Please feel free to come in and chip in from your experiences, and if there's anything I've said that you want to add to or obviously disagree with, please feel free. Emma.
Hi, Emma.
Hi, is it? There's two Emmas up. Is it me?
Yes, you're number one. One hand, and then we've got Emma Beniston.
Yeah, I think. Yeah, thank you. That was really insightful, and I've got lots of notes to take away and discuss with my team. So I work within a community setting, and we work with partners who are not always clinical. And I think my reflections of some of the interface issues is around understanding potentially clinical concerns in our freedom to speak up with our partners running services. Is actually we may raise things that are not understood around the importance of what we're feeling, and I think that's down to just general lack of understanding rather than possible I don't want to hear this right now. But it's a challenge of how we can escalate that with partners, and sometimes we're subcontracted in, so we're not that main partner, that lead organisation, and I think a biggest barrier for us in community settings is that how do we speak up about things that are potentially pertinent to a lead provider who doesn't have an understanding of that concern, sees it as a criticism. I think there's definite routes to be able to escalate within your own organisation, but when you actually challenge in another organisation, that escalation is a lot more murkier and unwielding. So I think it's just an observation and a challenge.
It absolutely is, Emma. Excuse me, I just decided to sit down because I've been stood up for a while, as if I would if I was with you. I'm just going to sit down now for our conversation. It is challenging. I don't think I have any easy answers. I don't know if anyone on the call does have some observations about that. I guess my first thought is again that leadership to leadership, having that honest conversation. We're just thinking. So I'm just thinking, just trying to put myself, if I was in your shoes, to have that conversation now with a partner organisation, and I think they might not take it like we're looking at it and as a gift, is to maybe have an initial conversation, depending on the severity of it, obviously, because if it's a really urgent, safety matter, then I just need to raise it, even if I hope you'll take this in the spirit and that I'm giving it you is some information that will help you improve your services because I am deeply concerned about type conversation. Or if it's not quite on that scale of it has to be addressed in that manner, can I have a conversation about what we're grappling with as an organisation, improving our speaking up culture? And I've been learning myself. I'm just thinking this might be the sort of conversational way I might do it. Might be completely wrong, but I'm just going to try this for size. And we're doing a bit of live role play here, which is probably a little bit dangerous with however many we've got on the call, but forgive me. And then I might decide afterwards, no, I definitely wouldn't do it like that. But at least I've practiced it, haven't I? But I might go down the route of, we're doing this work in an organisation trying to improve our speak up culture, because I just want to make sure that we're really hearing the voice of people to ensure that we've got safe services, best, most efficient, all the rest of it. And you know, what are you doing around that space? How do you find it? Because I can find it quite critical if somebody comes and says, oh, I'm not sure, Jane, we're doing X right, or I'm really worried about Y. Sometimes I can feel really defensive. And so we're doing some work on that. Are you doing any work on that? And then you get a bit of a measure of, and if they sort of just dismiss you out of hand, well, maybe you might have to go out to plan A, which is the more direct approach. But you could have an improvement conversation with an organisation that reflects on your own honesty, about a bit like you might in clinical supervision. You know, I guess I'm thinking it back to me being a clinician, but you don't have to be a clinician to have that approach. Yeah, just a thought, but others might have different ideas as to how they might approach it. But I think we have to go back to having those honest conversations, don't we? Which is probably where I started earlier in the presentation, and being comfortable with the uncomfortable, which includes sometimes uncomfortable messages. Yeah, let's face it, if we were the doctors in Countess of Chester speaking up about potentially a colleague doing things that are pretty unthinkable for any of us who are in a caring profession, they were having a really uncomfortable conversation, but they felt concerned enough to do it. So it's about us, you know, having that moral courage as leaders to talk with a partner organisation about, you know, please accept this in the spirit in which it is given, as I hope if you had concerns about my organisation, you would want to come and talk to me. I think that's probably the approach I'd do, but I don't know, tell me how it goes. Not that if they're partners around the table of your organisations, you're saying there is a problem, but just saying that it could be. Yeah.
No, loving the role play here, Jane. Keep it coming. It's great to have some tips and tricks, isn't it? And to hear the type of conversational skills and communication skills that could make our life easier in terms of making this happen for us. So that's brilliant. Emma Beniston.
Hi, yeah, thanks, Jane. It was absolutely fabulous, that the presentation. I think for me, just sharing a reflection, if I may. Well, Agnes is fabulous for a start, and she really does help to support, and also she has got a knack of this real, she enables us to reflect, which is amazing, and that's been really helpful for me. I think I now see everything as a gift. When I initially had a concern brought to me, I was very kind of personally, you know, I thought it was all on my shoulders. I'd failed. And it was a real reflective process that I had to go through to actually say, okay, how do we move on from this? And I think to see everything as a gift, it might be the most, you know, you might get down to the bottom of it and it's very small, but actually what does that mean to that person? And how can you make that change? I think is my new mindset. It doesn't matter what is brought to the table, or you know, from what avenue. It's how you improve from that, and it's just a reflection on seeing it as a gift. I totally agree. So yeah, I think in Spectrum we are empowered with CQC registered managers, so we have got processes where we absolutely can raise concerns and be supported, and also with our stakeholders as well. That's an answer to that question. But yeah, I just thought I'd share that reflection, really. It was a very powerful presentation.
That's really, it's very brave of you, Emma, to do that in this audience, because you were obviously speaking about where you didn't feel so comfortable about it. And actually, on our website, we have 100 Voices story. I don't remember them all, and quite often I'll go in and have a look at one to choose for a particular presentation I'm given, because they can be so powerful. But there was one I used in a presentation earlier this week, and it's about a manager who spoke up about the words freedom to speak up. She said, I've got it here in front of me because it was one I did earlier, had filled me with dread and fear, because it felt like a personal criticism of me, and very much went through the same process that you've just described. And that's okay. And it's okay to sometimes feel like it's and maybe it is a personal criticism, but it's how we respond to that criticism, isn't it? You know, I sometimes give presentations and I think myself afterwards, oh, that wasn't the best, you know, I wasn't on my best mettle, or I don't feel I got my message across as I wanted to. And sometimes I've had feedback, you know, you do your evaluation and, you know, it's not the, you know, 5-star that you want, but it's up to me then to take that, reflect on it, and use that to make my next presentation a better presentation, because I'm not perfect all of the time. As a manager and as a leader, my goodness, take off the expectations of perfection, progress, not perfection. And when it comes to speaking up culture and receiving information that our workers give us, think of it as let's make progress, not I've got to be some saint, some Mother Teresa that's going to accept everything beatifically. Sometimes we're going to be grumpy, sometimes we're going to feel defensive. That is okay if we reflect and then do something about it and learn to be better managers and leaders as a response of it, because we will all get things wrong. None of us were born a manager, weren't we? No more than Linda was born chief executive or I was born the National Guardian. Thank goodness. I think my parents would have found that hard. Yeah.
Jane, thank
Absolutely. And I think,
oh,
I think
sorry, Emma.
sorry.
Come back.
I think it's important to say the Francis report as well. We're now seeing the Francis report and the positives it's bringing from this movement, because it was, you know, when you think Francis report and freedom to speak up, you think mid-management cover up, and that's where the sense of dread comes, I think, in leadership positions. Have we got mid-management cover up? What's going on? And that's it. This movement is really removing that stigma, and it's removing it and normalizing this process. So yeah, it's fantastic.
Oh, thanks,
thank
Emma.
you. Thank you, Emma. I hope, Jane, if you haven't got a hard stop, there's definitely a fantastic question from Nimesh in the chat about is this an approach that's open to families and carers? Nimesh, is that your question? And then I know Vivian, you've also put your hand up before the 5 o'clock cutoff. But if Jane, if you are happy to continue,
I'm happy to stay on
we
for
certainly
5
are.
minutes. I am. Yeah,
no worries.
that'd be great. Nimesh, if you're certainly the Freedom to Speak Up Guardian route has been set up as a worker route, and there are different safety initiatives for patients and families, including, you know, Martha's Rule, etc., that are really important. Now, in fact, I've been invited by Henrietta Hughes, who actually was my predecessor in this role, but she's now the Patient Safety Commissioner, and who's looking at vaginal mesh and sodium valproate issues and compensation. But she's also been asked, I think, by the DH to look at Martha's Rule and implementation of Martha's Rule. And I've been invited onto one of the steering groups to have a look at some of the outputs of the initial workshops they're going to do around this. And I think it's really important because workers need to have a voice to speak up about, particularly around, you know, this is about clinical deterioration. So I'm really glad to be part of that conversation, because I'd like for us to think about, yes, we have freedom to speak up more generally, but if you're in a clinical situation and you felt that someone was deteriorating rapidly, would you have a fair ear to, I want a second opinion about this because I don't think, you know, we're managing it correctly, etc. So I think it's important to consider. But at the moment, Naresh, the speak up route is because there are other routes for patients and families to speak up. So we're talking today about worker voice, but as I said in that earlier slide, all three are really important: the public, patients and their families, people who use services and their families, and our workforce. Hope that's helpful.
Brilliant. Thank you, Jane, for really contextualising that for us and knowing where this all fits. And perhaps the last question, we could go on all evening, but we all have homes to go as well. Vivian, we welcome your question.
Well, it wasn't really a question. It was an observation, really, that when we talk about breaking barriers, we often look at the person that is observing an issue and trying to overcome the fear and futility, but actually the barriers at the other end as well. So the barrier is also, there's two people involved, isn't there? There's the person that is wanting to speak up, but there's the barrier that's holding the person back from actually listening. So it's almost like building a bridge. And the way I see it is you really got to look at these barriers at both ends, because there's still a block. There's still a block. On the one side, there may be fear, but on the other side, as Emma has clearly said and shown, that there is equal fear of a different kind. Is this a criticism? What's going to happen? Is this detrimental to, or whatever? It's still a barrier. It's just kind of an observation.
That's a brilliant observation, Vivian, and I absolutely love that analogy of a bridge. Those guardians who are on a call, bridge over troubled water. I promise I'm not going to sing, but maybe for another time. No, you don't want that. But actually, it's a really important analogy, because that's what we are doing. We're bridging between two people. People, you know, it's all about relationships, isn't it? And in a way, isn't that what speaking up is about? Speaking up is about relationships. In order to be heard and not have missing voices, we have to have people who are able to use their voice, and then people who are going to receive that. Because if it's not received, it's not listened to, it's not acted on, because we're frightened, fearful, don't have time, tired, exhausted, got something else to focus on, something else going on in my life personally, you know, all the many things. Or this person has spoken up to me before really nastily in the past. I don't really want to hear what they have to say because they might be quite, you know, uncompassionate about it, etc. Lots of things. At any point you say, Vivian might want to come and have a conversation with me, there are things that might inhibit me hearing, let alone listening, let alone hearing, and for you actually, yes, having that conversation. So you're so right. The barriers are multiple, and we need to think about how we lay that bridge so that we have a really safe bridge to cross over, because that comes back to that psychological safety, doesn't it? So I'm liking that analogy. You might have to think about how I can use that. Thank you, Vivian. That's really insightful. I'll take that away myself today.
Thank you so much. We are beyond the 5 o'clock on witching hour. It would have been great to have at least another hour to have a conversation with you, Jane, and you have absolutely mesmerised, I think, 50 plus people on the call tonight, and we are going to spread the word because you've kindly allowed us to record this session and to be able, therefore, to spread the opportunity for people to listen into the presentation and some of the dialogue that we've had afterward, which I think is an enormous privilege. It's been a fantastic privilege for Spectrum to host this as part of our Festival of Leadership and Learning. It's been probably the most favourite one I have had, in terms of the not just the thought-provoking nature of the conversation, but also the tips and tricks that you've sent us away with. It's always lovely to have something that we know that we can absolutely use in our day-to-day, and I certainly feel you've helped me personally and professionally tonight. I'm sure I speak for others. There is a little evaluation form, a little bit of housekeeping in the chat, and I just want to thank everybody who's listened and heard, I think, intently tonight. I can see that on the call, and those of you who've kept the cameras up. And thank you again, Jane. I can't thank you enough. It's been an amazing privilege to hear you speak tonight.
Linda, thank you. Can I just conclude with an observation? Thank you for your attention and staying on a bit later. Sorry that I ran over a bit. Honestly, I don't have all the answers. If you're doing stuff and I don't know about it, or we don't know about it as an office, please contact the office through our website, through the inquiries. Share your good practice, share your challenges. Really important, if you've got a guardian, speak to your guardian and, be part of that solution with them and their leadership team. Those of you who are in organisations that maybe don't have a guardian model, just really encourage you to think about not necessarily adopting our model wholesale, but how else are you providing those safety routes, and really importantly with your existing routes, how are you ensuring they work well for all parts of your workforce, not just some of them. Thank you with all you're doing. Don't be strangers to us as an office, and I'm really looking forward to the feedback as to how I can make these sessions as helpful and as as stimulating, challenging. I feel it by the level of conversation and the looking at the chat. So thank you, and hopefully see you all around, and keep doing your great work.
Thank you so much. And to all the guardians here, to our own guardian, Agnes, for the connectivity that we feel part of this movement, Jane, under your leadership. Thank you. Good night, everybody.
Big special thank you to all our guardians.